Good afternoon, and thank you for joining us. We have several people who will speak today, along with Mayor Coppinger. We have Health Administrator Becky Barnes, Dr. Adam Sufleris, and Dr. Brian Johnson, all of which will make brief statements, and then we will take questions afterwards. Then the Mayor will conclude with a final statement. We'll begin with Mayor Jim Coppinger.
Thank you, Mike. Good afternoon. Thank all of you for being here today. Have a really important announcement. Today we're here to discuss the future of the mask mandate, as you well know, and also issues that regarding COVID-19. As you heard, you're going to hear from several speakers today, and I'm just kicking it off. So I will say this: after much discussion, much consideration, I will ask the Health Department to extend the mask mandate through Wednesday, April the 28th of 2021. However, the mandate will be lifted and it will end on April the 29th. As we said from the beginning, the mask mandate would be temporary, but we would stay in place until we could accomplish several things, and we feel like we have. Among those things that we were trying to accomplish, as you well know, we had some serious issues with hospitalizations at one time. We certainly had serious issues with ICU, ventilators, and certainly the numbers of new cases that we were having every day in our community. All of that seemed to have leveled off for the most part. We have seen a gradual lift in the past 7 or 8 days, but nothing of concern, nowhere near what it was back when we were so concerned about it. But most importantly, what we said during that period of time is that the most important thing that we were looking forward to was the availability of vaccinations. And as you well know, vaccinations are here. So ending this mask mandate in 30 days, it's going to give our citizens some additional time to be vaccinated. Can't express to the public enough, or enough ways or enough times, how important it is to be vaccinated, and there should not be any hesitancy to do that. It's a personal choice that all of you have to make. I personally have been vaccinated, and I know most of the staff here has been vaccinated, and it's one of the things that we know offers you a lot of effective protection. We also wanted to not only allow people to be vaccinated, but also to give businesses opportunity for preparation over the next 30 days to gear back up to where they were comfortable. As you well know, many businesses were very supportive, and we thank them. Very supportive of the mask mandate. It gave them an opportunity to protect their employees prior to this vaccination. So they were very, very, very supportive. And I want to say a special thank you to all of our businesses, both large and small, here in Hamilton County, for being in compliance. We have been vaccinating since December, and during this period of time, the most vulnerable population, as you well know, were the first to be vaccinated. And so what we're seeing now, and I know Dr. Sufleris can speak to this, and so can Becky, is we're starting to see a trend downward in the ages of people that are actually infected with the virus. I did talk with the State Health Department earlier this morning, and they made me well aware of that the ages have gone down about 10 years. So if you're a young person out there and you're not vaccinated, or regardless of your age or whatever your situation is, and you haven't been vaccinated, you still need to be wearing a mask. You still need to be socially distancing. Although it won't be a requirement after the 29th of April, you still need to take all the precautions necessary. As you well know, this virus has infected more than 42,000 people in our community, and over 470 people have died. So this is a very, very serious situation. So if you haven't been vaccinated, you still need to give yourself some protection. I know there's people out there that disagree with it, and I totally understand. You know, you have the right to disagree. All that we're trying to do is to offer you some type of protection. Our health department, proud to say that now they've opened up vaccinations to anyone 16 and older. They did that last week. They're making appointments. I know it's booked up for the next couple of weeks, but stay tuned. They do a really great job. Carlina, who usually gets that information out promptly as soon as additional vaccine gets here. Becky meets with her staff, and those appointments go up quickly, and they get taken up pretty quickly. So again, stay tuned if you're 16 and up, which is pretty much our entire population. Our health department, in partnership with a number of other people, such as Walmart or Walgreens, CHI Memorial, Park Ridge, and of course Erlanger Hospital, have all partnered to be able to administer 152,468 vaccines to Hamilton County residents. Or most, I should say 30% of those are first shots, either of the Moderna or the Pfizer, and almost 15% of our residents have received either shots of Moderna and Pfizer or the single shot of Johnson & Johnson, which, as you well know, Johnson & Johnson only requires one shot. Again, we really appreciate all the partners we have out in the community helping us do this. I know that Becky partnered with, I think it was Southern Adventist this past weekend, and they administered 550 vaccines. Every time we can get a large number like that in the community, the more it helps us to get the population vaccinated. So, again, ladies and gentlemen, I just want to take this opportunity to again praise all of our health department, all of the leadership, certainly Becky Barnes, but all of the people that she has, some that are in this audience right now, but the ones that are on the front lines every single day, they're putting shots in arms. I want to make sure that we certainly give them all the acknowledgement that we can. They've been, again, as I remind you, they've been at this since March 13th of last year and have continued. I will clear this up for a lot of people that don't know this. I get a lot of emails about masks. We actually did not implement the mask mandate till July the 10th of last year. There's a misnomer that when this started on March 13th, we did a mask mandate. We didn't do that. We waited to see what would be the best action to take, and then obviously it became apparent that we needed to do some type of mediation. Masks were pretty much our only option until now, the vaccination. And as I said earlier, you know, we need to continue to protect ourselves. We are not where we used to be with hospitalizations. At one point in time, and I think this is worthy of the public knowing, when we were in the biggest crisis stage was when all of our hospitals were at 98 to 99% capacity. Again, I want to compliment our hospitals for the unbelievable job they did to stay up and running during a time when it didn't look all that great, and that was back in the November, early December part. Again, they found ways. They were very creative in what they were doing to keep ICUs open, to keep beds in the hospital open. But again, we were at 99% capacity. If you think about that, that is a very scary situation for your hospital to be. I will say this, that on average, on our hospitalizations, and only about 50% of those were Hamilton County residents. Only about 50% were Hamilton County residents. The reason I say that, we were trying to take care of our community the best we could. We were doing that with a mask mandate. We think the ones of us been involved, certainly with the advisory panel of physicians and people that I've talked with, everybody was in 100% of saying they are effective. It wasn't Jim Coppinger saying that. It was the medical experts that were saying, you know, these masks are effective, they are helping. And even though we were doing that, we were still at 99% capacity. But again, only 50% of those were Hamilton County residents. So what does that tell you? They were coming in here from other counties and from other states. And a lot of those counties and states did not have mask mandates. And so to our hospitals, again, I want to say a special thank you for all the work they did. I'm going to give a shout out to Erlanger Hospital, because they're our public hospital. They take any and everybody, and they certainly stepped up and did an outstanding job. In closing, I just want to say that the COVID-19 virus is still in our county, and we must remain diligent in our efforts, again, to minimize its spread. You're going to hear Dr. Saflaris in a minute talk a little bit about variants, but most importantly, want people to know that it's still alive and well, and you still have to protect yourselves from it. And again, so during the next 30 days, let's all continue to do whatever means we have to prevent ourselves from getting this highly contagious virus or any of the variants from this virus. Together, we've come a long way. We've come a long way since last March to get to where we are. So we don't want to take any steps backwards. There's many of you out there that are going to be disappointed about the mask mandate being lifted in a month. And there's a lot of people out there that have been disappointed because we've had a mask mandate. I can only say to you that with the consulting we've had from numerous people in the medical field, that we're comfortable with it. We went down the right path, and we're comfortable now with the vaccinations that are going to be made available. If we can just get enough people to go. If we don't get enough people to go, we won't have what they call herd immunity. So we got to get enough people to take these vaccinations. So I'm going to, again, close by just saying this, as I often do say, you know, you don't want to be the last person in Hamilton County to contract this virus. You don't want to be that last person, and you certainly don't want to be the last person to die from it. So you got to still go out, be very cautious, even over this next 30-day period when we'll get more vaccines in the arms. But again, with emphasis on the fact that even though it's not mandated, ladies and gentlemen, you better protect yourselves. This is it's still a pandemic. It's no issue to take lightly, and certainly none of us in this room are. We just feel as though the time has come with this vaccine, because we had always committed to that. When we got enough tools in our toolbox, that we'd pull back on it. And so the time has come that we feel like over the next 30 days, if everybody's very cautious, that we can get through that and going forward. So with that, I'd first like to call up Dr. Brian Johnston, our superintendent of schools, and he'll have some information about the schools.
Thank you, Mayor. And I want to say just publicly, again, as we've said in the times we had opportunity to come and speak, that your leadership through this pandemic has been absolutely amazing, and very appreciative of the privilege we have of working in a county with leadership that understands the importance of how we deal with situations that frankly have been and are this severe. Also have enjoyed being a part of the group that you regularly convene with Dr. Saflaris and others that have that medical expertise at the table, as well as Becky Barnes and the health department being just phenomenal partners through the midst of this. Can't say enough about the work our teachers and leaders have done. 88% of the days in which we have been eligible to be on campus, we have been on campus. And so we're very, very pleased with that. We also know that the mayor's mask mandate has made a major difference in the receptivity of our teachers, leaders, staff, et cetera, and community really as a whole, in understanding its importance in mitigating the spread of the virus. I think it's important to note, as the mayor just mentioned, that the virus is still amongst us, and I always try to be abundantly clear, just transparent with people, in saying that as long as COVID is in the community, as long as this virus is in the community, we will have some of it in our schools. Our goal has been, I think, as we shared really early on, not to be a source of spread. And if we notice any pockets in places where there is spread, we want to close them, and frankly, we will, and that's how we've responded. And so even today, we have a campus that's closed, and we may have more as we continue to go forward. We'll navigate those situations as we need. Our commitment is to keeping students on campus, and masks have played a key role, as well as distancing and washing hands and those other healthy practices. And so we will continue that through the remainder of the school year. And then as we go into summer, we will evaluate things going forward. We have full anticipation. We will be in school 5 days a week in August. We're not the phase tracker has been retired, and we're not going to bring it back at all. So we look forward to that sense of normalcy, and we'll make determinations on masks in the days that lie ahead. I just want to echo one last thing is I give way back to the mayor, Dr. Souffleras. It is important that, I really believe this, and I want to be thoughtful in how I say this, but let me just say this. I've had my first dose of the vaccine, and I will get my second dose of the vaccine later this week. And I think it's a really important step for our community. As the mayor said, and has said before, I don't enjoy being in a mask. I don't enjoy it at all. And as a member of this community, it's important that we all come together and take the steps that are necessary to do what we need to do. And so I do hope that many, as they wish, take advantage of the opportunity to be vaccinated. What really is, I think, as the doctor said, a medical miracle, and do what we need to do as a community collectively to return to normal, even better, having gone through this pandemic. So thank you, Mayor, for your leadership, and I'll turn back to you.
Thank you, Dr. Johnson. And if I could just give one big accolade to what Dr. Brian Johnson's been able to accomplish. I don't know of anybody in this state that's been able to keep their students in school as large a district as what he's had for as many days that they have. So, hats off. I mean, I think all of us know how important that is. Certainly all of the parents and teachers and anybody that's associated directly with our schools certainly know and respect and appreciate, the job that you've done, because it hasn't been easy. It's been very difficult at times, I know, for you. So the next speaker we're going to hear from is Dr. Adam Souffleras. He's an infectious disease doctor. You've heard from him before. He's part of the advisory committee that you hear me talk about from time to time, and very grateful for his service on there as well. Dr. Souffleras.
Thank you. Again, Adam Souffleras, part of the Mayor Coppinger's task force. When we compare numbers the last press conference to now, it's like night and day. Case counts, hospitalization, deaths, all down. We now have a vaccine, have vaccines, and the health department has done an outstanding job. When you sort of look at numbers around Tennessee, I think as far as municipalities go, the Hamilton County has to be up there with just an outstanding rollout, and we can't really say enough with testing and then later on with the vaccines. And I think one theme that I'm going to say, vaccines are really our way out. The way out of the pandemic, vaccines. Although we talked about the numbers being down from previous, last couple weeks we're starting to see cases going up, hospitalizations going up in various states led by Michigan, New York, and New Jersey. About 20 other states also starting to see case counts going up. And, we have some decrease in mitigation strategies. Mask mandates have just been cut out, maybe a tad prematurely. Restaurants opening to full capacity. And I don't think you could put mitigation and spring break in the same sentence with all that's gone on down in Florida. We've also, as alluded to by Mayor Coppinger, seen the rise of viral variants, especially the B.1.1.7, also known as the UK variant. This will increase transmission, makes the virus more contagious, and we're seeing an increased percentage in the aforementioned states that I talked about that are having problems, and even here in Hamilton County, as you read in the paper. And with that, there's the risk of further transmission. As you probably heard in the news or read in the news, they talk about this race between vaccines, getting people vaccinated and the variants. And again, the goal here is to try and prevent cases, get people vaccinated, prevent cases. As you have these variants circulating, there could be more cases. And as we've talked before, the biology of this virus, a certain number of people are going to get quite sick, some require hospitalization, and some will die. My partner and I, Jay Sizemore, we'll always meet on Mondays, and we sort of talk about what's gone on over the weekend. And last weekend, there were 19 patients at Erlanger, and that's a far cry from the well over 100 at the peak. But what was important is, Jay had said, all 19 were vaccine eligible at that particular time. So they met criteria, including the two 80-year-olds who were admitted to the ICU from an outlying county. That usually doesn't go well. So again, vaccines, vaccines, vaccines. We should make all efforts to vaccinate folks. You know, we've started certainly the most at risk, as Mayor Coppinger talked about, older folks. Really, anybody 65 and older account for 80% of the deaths. Obesity plays a huge role. Other medical conditions, heart disease, lung disease, smokers, immunosuppressed patients. And we've gone through and tried to get vaccines out to those folks, and now, as mentioned, anyone 16 and older. And this is going to be extremely important. Masks. You know, what about the mask mandate? I think Mayor Coppinger sort of summarized and really just sort of looking, the mask mandate after the surges of Memorial Day and the 4th of July, Mayor Coppinger said, well, we got numbers, what are we going to do? And got the task force together and had the leadership to say, we need this mask mandate. And boy, was he right. Again, the goal, mitigation strategies. We didn't have any medications to treat these people coming in and wanted to protect the hospitals and flatten the curve. And I think, as he mentioned, throughout the whole time, the highest peaks, it was always Hamilton County residents were less than 50% of the cases. And I think that was in large part due to the mask mandate and able to take care of some of the people from the outlying communities as well. Masks were also important for giving us some freedoms. You know, the word that was the eight-letter word that we never wanted to hear was lockdown. You know, we had that earlier. And Mayor Coppinger's task force is a great group, eclectic group of folks from business, medicine, school, health department, and a lot of good dialogue goes on, and it's really, really important. The task force in our last meeting said that we need to give time for anybody who wants a vaccine to be vaccinated. And that's where the month comes in. We've got a month. Those guys are going hard. And again, our goal is to get everyone vaccinated. And although the mandate's going to end, I'm sure, this is going to be part of my attire as I round in the hospitals, and I'm sure other places will have some guidelines. But again, for the individuals, it's going to end. What vaccine should I get? The answer, the one that's available to you, okay? It's tough to compare efficacy. Some people say, oh, I heard this one's 95% and this one's 76, so, I want the good one. You can't really compare. These were done at different times. They're earlier on. I guess the ones you could compare are Moderna and Pfizer, because they were done under ideal, same conditions in the same country with the variants, at a very low level. And they were right on, 94 and 95%. But thereafter, these vaccines variants were around. These vaccines were tested in various areas, such as Johnson & Johnson in South Africa, where we have variants. I think the important thing to know about these vaccines is that for Pfizer, Moderna, J&J, and we'll throw in others, AstraZeneca and Novavax. The fact to know is these are all about 100% effective at preventing hospitalizations and deaths. And if you want a vaccine to work, what do you want it to do? That's exactly what you want to do. So take the vaccine you could get. There's hundreds of millions of doses have been given worldwide. They're very safe, well tolerated. The main complaint is that of reactogenicity, which just means it's sort of your immune response kicking in, flu-like symptoms you get a couple days or for a day or two after the vaccine. If you've had COVID, you should get the vaccine. It will boost your immune response 1,000 times. And for long COVID, there are some studies now showing that after 2 doses of the vaccine, some of the symptoms look to get better. How's this all end? You know, I think we all would like this pandemic to just stop if we're done, you know, but when will it end? I suspect that this virus is going to be circulating for a few years throughout worldwide, throughout the United States, and throughout Hamilton County. The surges will be smaller because there's fewer susceptible people around. Individuals will be vaccinated or they've had prior COVID until we reach this, quote, herd immunity where there are not enough susceptible people around to sustain the viral replication. So with that, most people will either get COVID-19 vaccine or COVID-19. And I think everything we do in life has a risk and a benefit. Take a vaccine, pretty safe, or risk, moderate, mild, asymptomatic, severe disease, possible hospitalization, possible death. If you had a mild form, maybe long COVID. So I think really when we look here, we've talked, you keep hearing it, vaccine. You know, the risk of infection way outweighs that of vaccine. COVID vaccines don't stay around in your body. They're like an email sent to your immune system. The email comes out, it's a wanted poster, and it has COVID-19 on the picture, and then there are instructions for your immune system, how to take care of that. And then like a Snapchat, the vaccine is gone. There's been wide acceptance for physicians. Those physicians who have a chance to get it, almost all do. Nursing uptake has been a little slower. And like the mask, which allowed us to do more things, you get the vaccine, we could try and get toward some point of normalcy. And vaccines save lives. Unfortunately, there is a boatload of misinformation out there. And I would encourage anybody to talk to their physicians, talk to anybody on the physicians on the task force, to try and get the most up-to-date information, because really, again, vaccines are a way out of this. Thank you.
Thank you, Dr. Sifleris. Somebody that I didn't know until the pandemic started, and I've learned so much from him, and certainly have a great deal of respect for him, as I do all of the advisory committee. Now you're going to hear from somebody that really doesn't need an introduction, but I just want to take this opportunity once again to publicly say how much I appreciate Becky Barnes and these long hours and turned into days and weeks and months and now a year that she's committed herself and her staff and her people to fighting this pandemic. And the fight goes on. But again, I can't say enough good things about the way that Becky's dealt with this. And again, I'm very appreciative of our Administrator of Public Health here in Hamilton County, Becky Barnes.
Thank you, Mayor Coppinger, for your very kind words and, again, for your leadership. So, vaccinations are going well in our community. As it's been mentioned already, 152,468 vaccinations have been given to Hamilton County residents, and over 90,000 of those have been given by health department. So availability is expanding. There are many locations to get a vaccine. Many doctors' offices, clinics, and pharmacies now have vaccine. We have vaccination drive-thrus run by the health department. We have pods at 3 different locations, and we will add the Alstom as a 4th site when vaccine supply warrants that need. Other groups are also doing drive-through events. There are strike teams working on special populations. You can look up Vaccine Finder or our website to find locations for vaccinations. And as it's been mentioned again, most importantly, vaccinations are now open to anyone 16 and above in Hamilton County. All 3 vaccines have excellent safety records and are very effective in preventing hospitalizations and deaths. So this is an exciting time because we know we have the tools to end the pandemic. We just have to stay the course. We are, unfortunately, seeing people in our community that are choosing not to be vaccinated. So I would like to speak to you now if you have that current stance about vaccinations. You may think that because you had COVID illness, you don't need a vaccination, but you do. As Dr. Saflera said, we don't know how long your immunity lasts from COVID infection, plus the vaccine will boost that immunity. You may think that you're young and healthy and you won't die, but you might die. COVID has taken the lives of young and healthy persons. You may think you just don't need the protection. Some say when it's my time to die, I'll die. But let me say this. Others need you to be protected because that protects them. Others need you to break the chain of transmission. We are some time away from vaccine being available for children under 16. There are a lot of vulnerable children who can't yet be protected by vaccine and would likely die from COVID infection. Parents want even their healthy children to avoid becoming ill. But COVID for these vulnerable kids can be life-threatening. So I urge everyone 16 and above to get vaccinated so you won't be that epi-link who can't be to someone who can't be vaccinated. You don't want to be that bridge to someone becoming ill and possibly dying. So our current fully vaccination rate at 14.9% is a very good start. It is not close enough, near close enough to herd immunity. We still need vaccinations. We still need to wear masks and social distance to drive our case rates down to be able to get us back to normal. We can't stop this close to the finish line. We need to keep and work on all 3 of these interventions. Thank you.
Thank you, Becky. From here, I guess we'll just open it up for questions. Mike, you want to?
Waiting for the first one. It will be Brian and then Meredith.
For when you said that the mask mandate will continue in schools until the summer, is that one applying to teachers, and then is that because of the vaccination not being eligible to kids under 16?
So we, I guess about a month ago, announced that we were going to remain in phase 3 operationally through the remainder of the school year, right? So phase 3 mitigation strategies consist of mask. It also consists of us making individual decisions based on cases at an individual school. And so we've made that commitment. Obviously, we're still seeing some pockets and places where, there's some spread of cases. And so we want to keep students in school. I think to flip the question, when I look at masks, it's not, to me, masks are really, the focus is about keeping children in school. And so we want to get through this school year. We'll do some deep evaluation, work with medical professionals to try to understand what adjustments we need to make. But to answer your question, we're going to remain in what we called phase 3 from an operational standpoint, from a mitigation standpoint through the remainder of the year.
Thank you, Doctor. Meredith?
I understand that the mask mandate will be extended until the 28th and then lifted the 29th. But what about businesses who maybe want to continue? Will you support them, back them in any way? I mean, we haven't really had enforcement anyways, but what does that look like for businesses?
Well, I mean, just like with the school system, individual choices by the businesses. We expect some businesses to continue to ask people to wear masks. They do this to protect their employees. They do it also for some of their customers. I mean, the customers drive that, right? I mean, they want to make a lot of sales. I mean, what we're just saying is that, we're not enforcing it. I know Lowe's here. We've been the only people out there. The health department, it's fallen on their back to enforce this throughout the last 9 or 10 months that it's been in place. But no, we're not going to discourage. We certainly don't discourage any business that wants to have a mask mandate. That's totally up to their call. I would just say this: there's so much information out there, misinformation, as you heard Dr. Safleris talk about. There's so much misinformation out there about masks and other things that it's sad. It really is, about vaccinations. And we talk about this a lot in our working groups that's been dealing with this now for over a year, because you can find somebody out there that will support about anything you want them to, but are they a valid, place to get your information? People have to decide for themselves, and that's basically what we've done for the last year. I say that because, if you talk to the people that are dealing with it every day, that tell you how vicious this virus can be, and the fact that it's taken lives of all ages, it just doesn't discriminate. And so, if there's businesses out there that feel like they need to do it to continue to protect their employees, then that's what they need to do, just as what Dr. Johnson is doing with the school system.
Eric?
Hey, Mayor Copler, my question's for you as well. Main question to start is just, if not enough people get the vaccine over the next 30 days, which I know is one of the major intents you said of extending this mandate, would you consider reevaluating your decision to end it on the going?
Well, Eric, let me answer it this way. We said early on there were several things we need to take place before we could consider lifting a mask mandate. You've heard us talk about the new cases, hospitalizations, ICUs, and having the vaccination. What we can't do, nor do we want to do, we can't make people take the vaccination. So as a result of that, then, we've offered people tools to protect themselves when we had the mask mandate. Now with the vaccination, we're offering it, a much better way to do it. And so all we can say to the public is, you got to step up and do your part. You got to help with herd immunity, and you can't do that again if there's this hesitancy to take the vaccine. And let me say this, and I think there's another hospital in a similar situation than what Dr. Safleris mentioned. But for the ones that deal with this in this room every single day, it's kind of frustrating when you know that there's 20 people that are in hospital beds that could have taken the vaccine that didn't take the vaccine, and now in some cases they're fighting for their life. So I would just say to the public out there, this vaccine is going to keep you out of the hospital, save your life, and you ought to really rethink that instead of peer pressure from one group or another, or Facebook or Twitter or somebody telling you this vaccine's not a good idea. It is a good idea, and it's going on worldwide with very limited amount of issues.
Wyatt, sorry, Errol, follow up.
Yeah, no, sure, I understand that, and I appreciate that. Just to follow up on the question, is it fair to say it's pretty firm that April 28th will be the end of the mandate, as far as you know at this point?
That's obviously the intent. If we had some kind of major outbreak or something like we did in November, I mean, we would have to come back together and reconsider. But that's not something, I mean, that's worst case scenario, and that's not something that, that we think would happen.
Wyatt,
Another question for Mayor Coppin. Just kind of going off of what Dr. Suflera said, in talking about the states that have lifted their kind of requirements early, and that's led to increases. And you also talked about, during the surge of cases, a lot of our hospitalizations were coming from areas without a mask mandate. Just kind of similar to the last question. How did you come to the decision to make a hard date for that April 29th when there are so many variables, variants, and things like that?
Well, the most important thing in making the decision, first of all, of listening to this advisory committee and talking about what we're doing, but most importantly was the vulnerable population was starting back in December getting the vaccinations, and that was the health department was doing that pretty much on their own for a while because we were limited in vaccine. As you heard, they've done 90,000 on their own at the 152,000. So now that we have more partners or whatever, we've been even more able to get to that vulnerable population. In the beginning, the 65 and older, as you remember, we started 75 and older, 70 and older, dropped 65, then to 55. So, I mean, we've had ample time to get to that vulnerable population. They were also doing other groups of people, people that had some physical challenges that they did strike forces, as Becky mentioned earlier. So, that played a big part in it, is the fact that we know that it wasn't, we're not 100%, 90%, or even 80 or 70% with that vulnerable population, but they had the opportunity to do it. And that's what we've always said all along. Masks were going to be temporary until we could find a solution with the vaccine. The vaccine came on board. We're not making people take it. We certainly highly recommend it, but after we move past those groups, I mean, it can't go on like you heard Dr. Suflera say. It may be in our community for 3 years. We're not going to go on for 3 years with masks, obviously. You got to take some personal responsibility with this vaccine now that we know how effective it is.
This is a similar question. With us being at nearly 15% for fully vaccinated, by the end of April, do you have sort of a goal in mind for where you'd like to be at? And if we're not reaching that, would you reconsider extending the timeline?
No, I mean, it goes back to, what the percentages are and what the percentages are on the people that were the most vulnerable, the ones that were actually dying as a result of that. So if you look at those numbers, that was the focus all along, was to make sure that we could protect the most vulnerable people in our community, or at least give them the opportunity. And again, we've done that since December, people coming through the lines at 3 different sites, getting vaccines, people for whatever reason that choose not to do it. I know there's a small percentage of people that cannot take the vaccine because of health purposes. They may never be able to take it. And then there's some that don't for religious purposes, and they're not going to take it. But we still want to try to get to that 70% or better in every age group. So as Becky mentioned, so that it gives protection through herd immunity to all of our Hamilton County residents. So you're not just helping yourself by taking the vaccination, you're helping out others, primarily your own loved ones. Again, so, that's what people should really reconsider. If they, on the first time around, they said, I'm not going to take a vaccine, I've never taken a vaccine. This is different. This is not a flu vaccine. This is a pandemic vaccine for COVID-19.
Meredith.
I guess I'll say after this, it's pretty cool. We always say, wear your mask, social distance, wash your hands. So where are we at with social distancing and groups gathering? Do we have a limited number for that now?
No, we really haven't had a limited number. As you know, the state lifted that several weeks ago on the gatherings. But you know, Meredith, I mean, use common sense. There are gatherings that I will go to, and as I said earlier, I've been vaccinated. There are gatherings that I go to that I will still wear a mask. You know, I think that's important to note. It's just, you know, we're at a point in time where, you know, we're making a breakthrough, so you don't want to take a chance on spreading it or somebody, you know, spreading out. Although it's highly unlikely that I would get it. I'm still 5%, right? But it is highly unlikely that I'd end up in the hospital or die because I've been vaccinated. But I mean, still, and that's why we're still emphasizing, you know, the mask still offers protection. And if you haven't been vaccinated, we certainly are still recommending that you wear a mask, you socially distance, and that you avoid large groups of people that you don't know, and particularly people you know that haven't been vaccinated. And if they're not wearing masks, I mean, I would still be very cautious about walking into a crowd of people not wearing a mask. Still am.
Do you think this will be beneficial to our economy and businesses and possibly opening up a little bit more?
You know, we've been very fortunate here. As you recall, a lot of people forget this, but the federal government closed the economy for 2 weeks in the beginning, right? A lot of people forget that. They closed down for a couple of weeks and realized, hey, this is not really a great idea. And then here in Hamilton County, we never closed the economy down. The city of Chattanooga closed it down for a few weeks, and then the governor stepped in and said, we're going to allow health departments to make these decisions. And what we did then, we opened the economy back up with a lot of restrictions, and basically worked our way up to where we are now. But as a result of that, when we first started, our unemployment was double digits. We're down to, I believe, correct me if I'm wrong, Mike, 5.1% unemployment in our last numbers this past month. So we cut that in 50%. We were losing a lot of small businesses. They just couldn't stand the losses. That slowed down tremendously. We even let restaurants go back. They were operating at 50 and then 75%. And now it was like all you got to do is social distance. So we've been able to keep the economy going. We're doing a budget right now. I'm proud to be able to say our revenues are consistent with where they've been, our sales tax, property tax, and whatever. So we're in good shape there. And I think that's because we made the decision early on to say, we got to coexist. I mean, many of you heard me say that a lot. We got to coexist with this virus. The only way we can do it and keep the economy going, get the schools open that we knew were so important. Back in July, we made the decision. The only way we could do it is wear masks. And, you know, I know there's a lot of critics about that, but I totally believe that's what allowed us to keep our economy going. It allowed us to cut those unemployment numbers in half, and it allowed us to get the sales tax and property tax to keep this county running in the future. So I know there's a lot of arguments the other way, but I'm convinced we would not have been able to keep the economy going had we not chosen to wear masks.
Eric?
Hey, Mayor Commander, another follow-up question. So I know you reiterated during the press conference the importance of, people still wearing masks who haven't been vaccinated, of course, whether it's a mandate or not after the 28th. How about people who have already been vaccinated? Are you still urging them to wear masks moving forward? What's kind of the main guidance for them?
Well, they certainly need to wear masks for the next 30 days. And hopefully, again, I mean, I hope people are going to be, like most of us that have been around this and been exposed, understand that, the importance there. There are still places. I mean, if you're at home with your family, your entire family's been vaccinated, okay. That's probably okay. Or if you're at a neighborhood function and everybody in the neighborhood, y'all all went together, right, and got vaccinated, and you're going to have a cookout and do those kind of things, it's okay. It's okay to do larger events. We've had the championship wrestling at the Trade Center. We had the cheerleading competition. We got no negative feedback from any of that because they did what we asked them to do. They wore masks, they socially distanced. So we've been having large events. We're not saying don't do large events. We're just saying you need to do it, and you better do it with a lot of respect to this virus and be cautious. Again, I've said it from the very beginning. The virus is not something to fear, but it is something you need to respect. It's taken a lot of lives here.
And just one follow-up question, if that's okay, for Dr. Johnson. Yeah, Dr. Johnson, my question is just, I know, at least last night, I looked, and please correct me if I'm wrong, about 58% of teachers in the school districts have been vaccinated at this point. Were you surprised the numbers at that level? Do you anticipate that that will increase in the days ahead?
Yeah, so I think when you look, we've learned a lot about vaccinations. When you look at any vaccination historically, across the country, over time, roughly about 50% traditionally of the community take advantage of that opportunity. And that's what we're seeing play out in our community in regards to the COVID-19 vaccine. And so we're above that threshold, approaching 60%. And as the mayor mentioned, 70% as a goal. I would fully anticipate that we'll get really, really close to that. So we last week, we had doctors, Dr. Brooks, Dr. One-to-One, Dr. Helton, and Dr. Bruce and Dr. Smith. They hosted a town hall for us just to answer general questions for our staff and try to educate people. I mean, there's a lot of honestly, there's a lot of misinformation out there and things that, honestly, everybody's in this place of learning about the vaccine. So we're trying to learn and trying to inform our employees, which I know is happening throughout the community as well. And we've got that in its entirety, that town hall up on our district website homepage. Is our employees can continue to click and continue to learn. We have general or genuine employee concerns that we've heard. Everything from childbearing desires to future implications, and just trying to really bring some clarity from experts as to the implications of the vaccine. I think are critically important. Educating is critically important, obviously, for the school system. So yeah, that's what we're committed to doing, and we feel good about where we are from the standpoint of employees that have taken the opportunity, but definitely we're pushing to get to that 70% or even beyond. Yep.
Do you anticipate more of those hosting more of those education opportunities moving forward for your staff?
In regards to COVID-19?
Yeah, to the vaccine.
So I'll be honest, I want to get out of the COVID-19 business. Not necessarily, if I'm just being fully transparent. We're getting ready to transition. So, our focus is learning, right? I mean, we are a teaching and learning organization. We want to make sure children are positioned to be successful. It so happened that this medical crisis, for lack of a better way of saying it, has directly infringed on our ability to stick to our core business. When we think about our core business, the safety and security of students is critical, right? So we've had to pivot to ensure that we educate ourselves and we educate our teachers, leaders, staff, community, et cetera, about the implications of the virus, how we were going to operate, the vaccine, et cetera. We've kind of done a good bit of that, and so we look to pivoting away from that as a central message, knowing that we're still going to have to take steps, as we look at 21, 22, whether masks are in play for students or not, we're still going to have to do some things from a mitigation standpoint to ensure that our schools can operationalize. And so, we look to get out of the COVID-19 education business, hopefully.
We've gone almost an hour, so we'll let Mayor Coppinger wind it up with a final comment.
Well, I'll just be brief. And again, thank you, all of you, for attending the press conference. It's always important to be able to get the message out. And I think the biggest message we want to get out to the public right now is that, challenges at the vaccine locations. Keep signing up, keep coming. We want to keep putting shots in arms, and that's going to make all of us safer as a county and as a community The more people that we get shots in arms, the more safe it's going to be for you, whether you're at your grocery store or wherever you may be. It's going to make it better for you. So again, thank you all for being here. Thank you for all the people that participated today.
Thank you, everyone.